Hello, everyone. My name is Evelyn from the Christian Health Association of Kenya, and I will be speaking to you today on building health systems for NCD's care in faith-based facilities in Kenya. So CHAK is a national FBO made of Protestant churches, health institutions, and programs in Kenya with over 500 members and has been operating since 1946. In 2024, we implemented a health system strengthening project, which built on gains learned from the Novartis supported Familia Nawiri project, which was implemented from 2021 to 2023 in 12 hospitals in Kenya. This project focused on awareness creation, screening, and capacity building for optimized care of NCDs, and it focused on hypertension, diabetes, and their complications, epilepsy, sickle cell, and breast cancer. We also were able to strengthen the monitoring, evaluation, and learning systems for this. The key takeaway from this project was that there was a need to focus on building facility health systems to improve quality NCDs care. And thus, the CHAK Health System Strengthening Project was born, again supported by Novartis, and it had the project goal of enhancing healthcare systems within 12 program hubs or hospitals to offer quality, sustainable NCDs care. And we were focusing on cardiovascular disease, diabetic retinopathy, epilepsy, sickle cell disease, and breast cancer. Under our first objective, we were looking at capacity building, and we did this through online and physical CMEs, as well as trainings that were both virtual and physical, as well as on-site mentorship and support supervision. As a result, we were able to see an improvement in knowledge, for example, a 27% improvement in the CMEs scores, as well as 30% improvement in the training scores. We also saw the support supervision scores improve by 31%, showing that the systems were indeed improving to support quality NCDs care. Some of the highlights of this project were lessons learned on integrating HIV and NCDs. And some of the best practices were integrating awareness and education, where we were tailoring messages for both NCDs and HIV and using the systems in both of these areas to give those messaging. Also integrating screening, where diabetes was screened as well as HIV, as well as training healthcare workers on management of NCDs and special groups, including people living with HIV. Another important area was enhancing affordable medication and technologies such as HbA1c machine and affordable insulin, which was done through our access programs. Patient empowerment through psychosocial support groups also remained key. From this, we were able to learn the value of a chronic care model where patients with chronic conditions could all get care under one roof. This was done very well in facilities such as Kijabe in Tenwek. And their process included sensitizing the patients on the importance of this initiative, restructuring their infrastructure, streamlining data capturing and reporting, training staff. Some of the benefits they were able to see from this was reducing stigma, waiting time, and enhancing collaborations, and overall giving a holistic service provision and better patient satisfaction. Challenges such as staffing, capacity, and space remained. However, the key take home from this was that integration was a sustainable approach to offering care for patients with chronic conditions. In the same vein, we were able to look at or strengthen systems for integrating mental health in NCD's care. And we saw that this was an area that needed intervention. For example, one of our facilities, Tomotomo Hospital, did a rapid assessment of mental health among their patients with NCDs, and they showed that patients experience symptoms of anxiety, depression, stress, and even one had suicidal ideation. Our interventions here focused on training healthcare workers to screen and manage mental health conditions. Screening was done using the standard tools, as well as referral for mental health to mental health specialists for management. We also looked at how to integrate GBV in NCD's care in the same spirit of providing holistic care for patients with NCDs. This involved training of healthcare workers to be able to screen for signs of GBV, to enhance their documentation, to collaborate with key stakeholders, and to have conversations on how to link GBV interventions with social behavior change interventions for promotion of prevention, treatment, and management of NCDs. In all of this, we were leveraging on systems that had already been built for HIV, where they had prioritized GBV. Under disease awareness, we were able to reach 98,219 persons with health promotion messages on the NCDs. As a result of our interventions, we were able to enroll 11,594 patients onto care, and those were patients with the varying NCDs as seen. Assessing control has been a very big gap in the country and also in our facilities. For this, we emphasized the assessment of control using the HbA1c test for diabetes, and also looking at the development of complications and admissions. We strengthened facility assessment by strengthening systems to capture data for HbA1c and analyze that as well. As a result, we saw that 50% of our patients who had the HbA1c test were achieving the target, which is less than 7%. And for this, that was actually an improvement of 14% from baseline. Admissions due to hypertension during the project period decreased by 1% from baseline. To be able to drive through our interventions, we worked very closely with our leadership, which proved to be very successful as they were able to provide commitment and guidance for the action plans that had been developed as a result of the support supervision findings. From this, we saw that there was a 73% progress towards the action plans. Some of the key lessons or the way that we were able to share lessons amongst the implementing facilities were through joint learning sessions, where we could do data review and discuss the various strategies such as control, integration, and optimization of the health records management information systems for reporting and reflection on overall performance and sustainability. Facilities were able to share their best practices as well as their experience. From what we can reflect on this, a key success point was involvement of the health facility leadership in joint action planning and tracking. It was also very important for us, as we have seen, to be able to strengthen systems to collect data and analyze it in terms of control. This is something that the country as a whole has been struggling with only around 40% of patients who have diabetes achieving control in the country. So this shows that there is a need to sustain the investment on health systems to be able to have impactful, scalable, and sustainable improvements in NCD care delivery. Thank you very much.